thank you very much, as I say, for inviting me up today. So I'm going to talk a bit about community nursing and how we can support the 5-year forward view, and hopefully demonstrate that nursing has got a strong voice, but I think we need to make it stronger. Okay, so just to remind us what we're all here about and what the NHS Constitution says, and I think John made a very good point earlier on that the future is in our hands as nurses, and our voice is very quiet at the moment. We have to do something about that. Nursing is very much integral to the 5-year forward view, and I don't know how many people have actually read it. Let me have a show of hands and see who's actually read it. Oh, excellent. That's the best result I've had from any talk I've done recently. That's good to know. It's actually a good document, isn't it? It's very readable, isn't it? And probably quite unlike any documents you've come across in the past from the Department of Health in particular. It's a very determined effort on behalf of Simon Stevens to create a meaningful document across all the NHS organisations that will transcend the general election, which is about to hit us. So that's our roadmap for the future, if you like, and I think it's something that we could all happily sign up to, whatever the colour of the next government is. So these post-it notes are the kind of headlines of the 5-year forward view, and I think without doubt nursing is actually integral to every one of those. The good thing for nursing, I think, is that in all the main organisations now, so NHS England has got myself as primary care nurse advisor. We did, or we will have till the end of the month, a community nursing advisor, Sue Hill. I expect some of you have met Sue. Sue's actually leaving at the end of the month, but she will be replaced, so there will be a community nursing advisor. The RCN has got a professional lead for community and primary care nursing. CQC has got a nurse leader. There's somebody, a nurse, a practice nurse in Health Education England. And I think it's the first time for a long while that we've had that sort of leadership at a national level for out-of-hospital care. So for me, that's really good news. I'm going to go through some of these other post-it notes as we go through the presentation. But those, as I say, are the headlines, with prevention deliberately put at the top, which is something we've probably not considered enough in the past in community care. And we'll talk a bit more about that. So in terms of what the 5-year forward view actually means for nursing, the absolute focus is on prevention and incentivising healthier individual behaviours and role modelling those individual behaviours, targeting prevention programmes around some of the long-term conditions, particularly there's a focus on diabetes. The other bit, and I think you're going to have Magda from the Southwest speaking to you by phone later on. Magda's going to talk a bit around how they've empowered patients and engaged communities down in the Southwest with something called the Living Well programme, which is a programme that's very much about recognising their district nursing services were snowed under, as most district nursing services are, and thinking about how can we stop being so busy and do what only nurses can do best, rather than doing everything for people. They've engaged their voluntary services to actually work in partnership with them in the community. And it may be something that you're doing up here as well, I don't know, but it's just a really good example of how you might think about doing it. The empowering patients bit there is very much around integrated personal care, supporting patient choice, sharing leadership with patients, shared decision making, all those sorts of bits of language that you're familiar with, but actually making that real for people. I think one of the disappointing things here is that whilst we've been talking about moving or shifting care out of hospital for years and talking about how we need to develop nurses who can work outside of hospital, the reality is that in the last 10 years we've only had a 0.6% increase in the nursing workforce. That's really disappointing, isn't it? So we're not getting it right in terms of attracting nurses to work out of hospital. Might be something you want to consider. And what's the image of working in private and community care? You know, do we enable students to come and have the proper assessed placements in general practice? I know in the north of England actually you're probably better than the rest of the country at making that happen, but there are some places where it's very difficult for students to have that proper experience. So this is looking at the 5-year forward view and looking what the opportunities are for community and primary care nurses. I've just pulled out some of the headlines there. So the focus on prevention and public health is around implementing the NICE guidelines around behaviour change. Are people familiar with those? Yes, they're relatively new and they operate at a range of levels, but they do require developing some new expertise, I think. So there's some learning to be had there around how we make the most. It's not just about making every contact count, but making the most of every opportunity to get that public health and prevention message across. supporting information for self-management and personalised care. I think as nurses, one of the things we do is we like to care for people, don't we? And actually caring for people, whilst that might be necessary some of the time, actually does have the tendency to create a bit of a dependency model, doesn't it? So some of this is about how can we actually help people, how can we care about them and care with them rather than just care for them, which is our tendency, and probably what we were trained to do. I've talked a bit about engaging with communities, and we're going to hear more from Magda from the Southwest around that later, and how we might develop really meaningful partnerships with the voluntary sector. And then John's already alluded to the new models of care, and new models of care that multi-specialty community providers, the primary and acute care systems. BSH is the viable smaller hospitals, and then enhanced care in care homes. Now, if you've read about the Vanguard applications, there were 260 plus applications from different healthcare systems to be one of these new models of care. Within the Nursing Directorate in NHS England, we divvied those up and looked at them with a nursing hat on, and we all looked at about 30 each. So I looked at 30 different applications from all over the country, and only one of those 30 mentioned the word nurse at all, in any context. We're talking about delivering whole systems of new care without mentioning the nursing contribution. So we've decided in the Nursing Directorate that our next job is to actually make contact with those successful vanguards, and there are 29 of them, and actually talk to them about what their nursing model might be. Because particularly for practice nurses, I think, the challenges around working with your district nursing colleagues are nothing to do with lack of will, they're nothing to do with the lack of wanting to care for the same population. They're much more about artificial barriers that have been put in place around employment models and around the way that we're commissioned. We're commissioned separately at the moment, and I know co-commissioning is on its way, but I think there's probably still a long way to go. So unless nurses talk about how we might like to be working, how we could contribute to that new system, I don't think there's going to be any change. We will have medically dominated models of care, and that I'm sure wasn't Simon Stevens' intention when he wrote this document. Leadership at a local level, I've talked around the fact that we have leadership at a national level, and I think it's very important that you engage with leadership at a local level, and again I think you're quite lucky in this bit of the world. This event today is all about leadership at a local level, so I think it is happening, but it isn't happening everywhere. And I've certainly noticed since the demise of PCTs that practice nurses in particular are suffering from a lack of leadership and understanding about where to go for support. Again, that might not be the case here, but it certainly is around the country. And then, you know, underpinning all of this has to be about improving the quality of care for our patient population, which is around patient safety, the experience patients have of the care they receive, and the effectiveness of what we do. So we need to stop doing things that don't work, in other words, use evidence-based medicine and evidence-based care. So there has been a huge programme of work nationally that was called the Community Nursing Strategy, launched by Jane Cummings, who's our chief nurse, back in 2013. It's changed its name, as all these things do, to Transforming Nursing for Community and Primary Care, which I think is a bit more meaningful than the Community Nursing Strategy. And the idea of this programme of work, which has engaged NHS England, Public Health England, and Health Education England, is around ensuring that we contribute as nurses to the development and implementation of the new models of care, that we consider the implications of the Shape of Caring. Have people read the Shape of Caring yet? That was published last week, and the Shape of Caring is the review of nurse education that's been published by Health Education England. The good news, if you haven't read that, and you can download the executive summary, which is just has the recommendations, is it mentions community and primary care nursing more than once, and the need to have more of us. I'm not sure about more of us, but we need to be deployed to do the right thing, to use our skills appropriately. Again, quite an easy read. There are only recommendations at the moment because it was an independent review, but Health Education England will currently be responding to that and deciding what their actions are actually going to be to meet those recommendations. Compassion in Practice and the 6 C's, that programme of work actually finishes in September, but we're starting to talk now about NS2, which sounds to me like a rail rider. NS2 is Nursing Strategy 2, so the next version of all of this in the new world, post-election and post-5-year forward view. And then a huge thing around how do we share good practice. I go around the country doing a lot of these sorts of talks, and I hear about some really good things going on. One of the questions I often get asked is, how do we know what other people are doing? Really hard, isn't it, to find out nationally what good practice is happening, unless you sort of are a regular attender at conferences. We need a place where we can host all those examples of good practice. And at the moment we're looking at it being the 6Cs live website, and there is a practice nursing and a community nursing part of the 6Cs live website, and I'm encouraging people to post their examples of good practice on that, because that particular website I think will continue regardless of any changes that might happen for political reasons. So what we know about community and primary care nursing is that, and John's alluded to some of this already, we do need to meet the health and care needs of people in their communities, but we need a different approach, because your crisis locally has demonstrated that you can't go on doing things the way you're doing now, so we need to do it differently. John's talked about frailty already. We have an ageing population. I'm part of that ageing population, as are we all, and we all want to be looked after in the right way as we get to that point. The needs of our communities are changing, so we do need to start thinking about turning off the tap, preventing people from getting ill in the first place. We need to engage and mobilise community and primary care nursing. There's a lot of expertise outside of hospital to keep people in their homes or in their preferred place. And we need to work in partnership with a range of other local organisations. So the things that are going to help us to do that may well be the new models of care, a greater emphasis on well-being and prevention, personalised care planning and self-management, and skilling up the workforce, and that's what the Shape of Caring review is all about, to make sure that nurses, when they newly qualify, are able to work quite quickly out of hospital, and they're not required to stay in hospital for that myth of 2 years experience before they come out and work with us in the community. And we need to work across organisational boundaries. So we've done quite a lot of work in this Transforming Nursing programme already. There are 4 different work streams which are around commissioning development, integration, prevention and workforce, and I'll talk a little bit more in detail about those. So commissioning development work stream has been looking at community workforce commissioning specification, or a workforce planning tool it's being called up to date, up to now, and that will be published at some point in this year, and some of you in the room have been involved in developing that, I know. We've developed a commissioning nurse leaders network, and this is a virtual and real network of all the commissioning nurses within CCGs and area teams who come together face-to-face or virtually by webinars around particular areas of interest for them. So they do share good practice at that level, which is great. Looking at pricing and incentives, some of this is around the co-commissioning and block contracts and unbundling tariffs that actually make some of working together quite difficult. And are you familiar with the frailty toolkit that's recently been published for general practice? Google that if you haven't, or I can find a link for you. Very useful piece of work that's been led by a nurse consultant, again from the Southwest, called Helen Linden. And Helen Linden sits in the nursing directorate at NHS England as our older people's nurse advisor, and she's been instrumental in getting this toolkit together. Very useful piece of work. My particular role, as you might expect, has been around general practice nursing. I'm a practice nurse and district nurse by trade, so it's been great to be part of this. And one of the things I've been doing, I was tasked when I came into post with developing what was called an assurance framework, something for the commissioners to understand whether primary care nursing was of a good quality, because working in one of 8,000 different practices in the UK or in England, it's very hard to know whether there's a standard around the nursing contribution. There isn't currently at all, or is there? What I discovered was there's something called the Primary Care Web Tool, or the Primary Care Medical Services Assurance Framework, which every single practice in England has to upload data into around not just QOF, but a range of indicators. And every year they're also required to declare that all their healthcare practitioners are on a register, on a professional register, that they're all DBS checked, and that they're all appropriately trained to deliver the contract. We've got some practice managers in the room, haven't we? Yes. So are you familiar with the Primary Care Web Tool, part of the contract? Yeah. Normally when I talk to people, almost nobody's heard of it, but it's a really, really useful tool, isn't it? And we're trying to work out how we can make it more useful for nurse commissioners. So a good example would be if a practice, so what you can do with the tool is compare your performance as a practice with neighbouring practices in CCGs or at an area team or a national level, and you may be flagged as an outlier for particular indicators. And I think if you're an outlier around an area that you know is nurse-led, like long-term conditions management, for example, that might make you focus down on, is that a nursing contribution that's leading to that being an outlier, or is it something else? It's not meant to be judgmental, it might just flag up questions being asked around why that's happening. It's also that the data from the tool is also used to inform CQC, and it informs part of the intelligent monitoring data that CQC use when they come out to visit practices. So as a nurse delivering some of that contract, or a lot of that contract I would argue, I think it's quite important to know where you are within that system and how well you're doing compared to your neighbours. And if there's variation, that might be fine because you have a different population, but I think it's important to understand why that variation exists. We're looking very much, as I alluded to earlier, at how we might provide better leadership for practice nurses, because it is a challenge, and I think it will become an increasing challenge as we move towards appraisal for revalidation. And actually, who is it that's going to be the confirmer for the practice nurse, particularly in small practices where you don't have a team, you might not have a nurse manager, your practice managers or GPs might not be familiar enough with the nursing role to be that person, so quite an interesting area there. The other bit for me around nursing leadership is around where the roles and responsibilities lie for some of the challenging, high-risk activity that practice nurses undertake, like vital screening, childhood immunisation. That sort of governance seems to have fallen into a bit of a hole at the moment now that we've separated things out into local authorities and Public Health England, NHS England, different commissioners, etc. So I need to get a bit of a handle on that. So that's some of the sorts of things that are going on. People heard of the 10-point plan, the GP 10-point plan? This is a 10-point plan that's written about the GP workforce, and my mission at the moment is to try and contribute, again, the nursing voice to that. It's about the primary care workforce, but actually it only talks about GPs, and I'm trying to say the primary care workforce isn't just GPs, it's nurses as well. And so we've been asked to contribute to some of those 10 points, which are around recruitment and retention, returning and retraining people that leave and come back, and all the things that requires. The integration work stream, again, there's some very useful documents that have been published. These handbooks on case finding and risk stratification and multidisciplinary team working are published on the NHS England website. Very, very useful documents around integration. That's the link, and you're going to have these slides at some point. Yeah, so you'll have the link to those resources, and we'll send these out to you. The workforce work stream is being led by Health Education England, and that's currently, and again, some of you I know are involved in this, it's developing a career pathway for both community and primary care nurses. Very difficult, I think, for a newly qualified nurse who particularly wants to become a practice nurse to know how they get in, how do they start doing that. And also there is a lack of practice nurse, particularly education programmes that are widely accessible. So Health Education England are working on those things currently. The prevention agenda is particularly around implementing the behaviour change framework and the framework for personalised care, which is separate, that the Department of Health and Public Health England have produced, which are really, really good resources if you're looking at developing your prevention skills. So we're working collaboratively, as I said, to develop a nursing response to the General Practice 10-point plan. We're supporting implementation of the new models of care and establishing a community nursing workforce commissioning framework. Our challenges are around getting that message out there and thinking about what the next steps for transforming nursing for community and primary care look like when the programme comes to an end in September this year. I talked about nursing strategy too. We've developed a national forum for community and primary care nursing, and I know some of you in the room are members of that, which is great. That's to encourage two-way communication between yourselves for actually delivering the services and the people who make decisions nationally. Very important that that's two-way, not one-way, I think. And we need to think about how we mobilise together so we maximise the nursing voice in the 5-year forward view. If any of you have met Crystal Oldham, that's what she said, it's time for community nursing to step up and take the challenge. I absolutely support that. Just a little bit about the 6 C's at the end there, in case anyone's forgotten. Well, that's the 6 C's website where the practice nursing and community nursing pages are, and where you might find examples of good practice if you're looking at setting up new projects. Thank you.